Picture this. You've just had a tooth pulled out. Maybe it was due to decay, gum disease, or an unfortunate encounter with a popcorn kernel. Whatever the reason, now you're left with a gap in your smile and a burning question. Do you really need a dental implant? In case you wondered, I'm Larry Dougherty. I've been a dentist for 16 years, and you can find me here at Rolling Oaks Dental in Garden Ridge, Texas. Today, I'm here to break it all down for you. We're gonna explore the pros and cons of getting a tooth implant, what happens if you don't, and some alternatives. Plus, I'll sprinkle in some fun facts to keep you entertained. Ready? Let's do it! First things first, what exactly is a dental implant? It's a titanium post that acts like a tooth root, surgically inserted into your jawbone. Once it heals, a crown is placed on top, giving you a tooth that looks and feels just like the real thing. Now, I know what you're thinking.
Dr. Larry, Dr. Larry.
Titanium in my jawbone? That sounds intense. But hold on, before you run for the hills, let's talk about why implants are pretty amazing. Here are the top benefits of getting a tooth implant. 1. Durability. Implants can last a lifetime with proper care. They're like the superheroes of dental solutions. Bone health. Implants stimulate your jawbone, preventing bone loss that naturally occurs after an extraction. Appearance. They look natural. No one will know it's not your real tooth unless you tell them. Functionality. You can eat, speak, and smile with confidence. It's like having your old tooth back minus the cavities. Dental implants have been around since the 1960s. Let's talk about the 1960s. You had the Civil Rights Movement, JFK assassination, the Beatles. Let's spend the next 10 minutes talking about Sgt. Pepper's Lonely Hearts Club Band. Okay, we're back. What were we talking about again? Oh yeah, I get it. Not everyone's ready to jump on the implant bandwagon. So what happens if you don't get an implant after an extraction? Without an implant, the space left by your missing tooth can lead to some issues. Your jawbone might start to deteriorate because it's not getting the stimulation it used to get. This can cause your other teeth to shift, leading to bite problems and changes in your facial structure. Yowzers! And let's not forget about the practical stuff. Chewing can become tricky, and you might develop a lisp. Plus, that gap can become a cozy home for bacteria, leading to more dental problems. But don't worry, if an implant sounds too intense or isn't right for you, there are alternatives. A dental bridge. This involves placing a false tooth between two crowns on the adjacent teeth. It's a good option, but requires healthy teeth on either side of the gap. A partial denture. A partial denture is a removable option that can be less invasive, but can be less stable and less comfortable than a bridge or implant. A resin bonded bridge. Also known as a Maryland bridge, it's less invasive and doesn't involve crowning adjacent teeth. These only work under certain situations with ideal conditions, so it's important to weigh all the options and discuss with your dentist. All right, so we've covered the what, the why, and what if. Now let's tackle the big question. How do you decide if an implant is right for you? Here's a handy checklist to help you decide. Your oral health. Do you have healthy gums and enough bone to support an implant? Chances are you do, but your dentist can help you figure this out. Budget. Implants are a big investment of time and money. Consider if your budget allows for this investment in your oral health. Long-term goals. Are you looking for a permanent solution? Or are you okay with something that might need replacement down the line? Medical conditions. Certain conditions like diabetes or smoking can affect healing. Discuss these with your dentist. And remember, it's not a decision you have to make alone. Your dentist is your best ally here. They can assess your specific situation and guide you toward the best option. Okay, myth-busting time. Myth number 1, implants are painful. False. With modern anesthesia and techniques, most patients report that the procedure is no more uncomfortable than a routine extraction. Myth number 2, implants are too expensive. While they can be costly up front, consider them like an investment. They last longer than bridges or partials, which might need a replacement or adjustment. Myth number 3, implants look fake. Not true. A well-done implant is virtually indistinguishable from a real tooth. Your secret is safe. So do you need a tooth implant after an extraction? The answer depends on your unique situation. Implants offer amazing benefits and can significantly improve your quality of life. But there's also viable alternatives if implants aren't your thing. Thanks for tuning in. If you found this video helpful, give a thumbs up, hit like, subscribe, all that stuff. Questions or experiences to share about tooth implants? Drop them in the comments below. See you next time.